Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hey there. Welcome back, everyone. Today we've got a great topic. We are diving into pediatric asthma. And let's start, as always, with our parent question. Here's Mike.
Hi, I'm Mike. My little boy just got diagnosed with asthma. Does that mean he won't be able to play sports?
That's a really great question, Mike. And I am so glad you brought this up because there are many kids who deal with a diagnosis of asthma. And particularly one of the things we often hear about are concerns about your child's ability to play in sports. Well, I'm excited to share with you today that we have an expert to help us answer this question and more about asthma. Erin Antonellis. She is a nurse practitioner at Boston Children's Severe Asthma Program and an expert in asthma. So glad you could join us today. Thank you for being here.
Thanks so much for having me. Appreciate it.
I always like to ask each of our guest experts a little bit about who you are and why you got into the field that you're in. So I was curious, how did you decide to become a nurse and a nurse practitioner and then specialize in asthma care?
When I was a teenager, I had a cardiac procedure actually here at Children's, and I thought this is going to be a really scary experience, but it wasn't. And I fully attribute that to the nurses that took care of me. And I was really in awe with how smart they were and how comfortable they made me feel. And that's when I started to think, I want to do this for other people. So fast forward, I become a nurse. I'm working in urgent care. And I'm shocked at the amount of kids coming in having asthma attacks. And sometimes it's even the same patients that are coming in. And I was thinking, okay, we're treating this acute episode now, but there's so much more that parents need to know about in order to gain control of their asthma and make sure that they're not coming back to urgent care again. So I thought this would be a really good opportunity to get myself involved in teaching parents more about their child's asthma, and thought it would be an area that I could really make an impact.
I absolutely love that. And I mean, I think, for myself too, being in healthcare, for sure, it was the experience of the nurses and the doctors that took care of me that influenced my decision to go into this field as well. So I love to hear that you had such a positive experience as a patient. Unfortunate that we were both patients, right? But at least we had great people to take care of us, and here we are today. There's a lot of kids that have asthma, but really, what is the definition of asthma?
First, it's a chronic condition, which means that it's something that doesn't go away, even if there are periods of time when it is more active or periods of time where it's quiet and you're not having a lot of symptoms. It is also generally reversible, which means that a person starts to have asthma symptoms. We can have those symptoms usually go away if we give a certain type of medication, right? So there are 3 things that happen in the lungs that cause the breathing tubes to become obstructed or narrowed so that air can't flow through as easily, and it makes it hard to breathe. The first is that the airways are chronically inflamed or swollen. And when you have an acute asthma episode, they become even more swollen. And this causes the breathing tubes to become smaller than they normally are.
Do you always have inflamed airways and then it just gets worse during an exacerbation, or does it really come and go?
Exactly. It's always there. There's always an underlying level of inflammation, and it does get worse when you have an exacerbation. To explain inflammation in a way that people can relate to a little bit better is, imagine yourself when you have a cold and in your nose you feel that it is full and irritated and it's constantly running and you can't really stop it.
Yeah.
It's similar to what's going on inside the lungs in the breathing tubes.
How awful.
Yeah. So that's one thing.
Yep.
The second thing is that there are the muscles that are wrapped around the breathing tubes that squeeze and constrict it, which leads to even more narrowing of the breathing tubes, tightening. Yeah. Exactly. And the third thing is that there's mucus production inside of the air tubes, which blocks them even more.
Wow. So when you combine all 3, it makes it very hard for someone with asthma to breathe, to get air in through those, your windpipe, so to speak, into the lungs. That's tough. That's a lot going on. So thinking about like the physiology of what happens with asthma, I'm curious, is there variability sort of from less severe to more severe symptoms in kids with asthma?
Yeah, so asthma is different for every kid, and it can change for the same person as well. There's a range from mild or intermittent, where you're only having symptoms occasionally, to persistent or severe asthma. You're having symptoms all the time, and that may require you to take medications every day. Things that we think about when determining severity for a patient is how often you need to use your rescue medicine to control your symptoms, how often you are having symptoms in the daytime and at nighttime, how restrictive is asthma on your ability to do normal activities that you want to do, and how often you need to use medication like prednisone to gain control over your symptoms.
So that's a lot to consider. Who ends up making that determination? Is it the patient, the doctor, the nurse, the team?
The provider typically makes that determination, gathering all that information.
Yeah.
For some patients, that can be your primary care provider. There are asthma specialists that can also make that diagnosis.
So it's your care providers that help you, and then along those lines, I imagine being able to decide or sort of differentiate mild to severe determines what the treatments or the best prevention and treatment plans are.
Exactly.
That's great. So let's talk a little bit about asthma, because I feel like everybody's heard of it. Really, how common is it in kids?
Yeah, so it's one of the most common chronic conditions in kids in the U.S.
Wow.
There's about 1 in 12 people, which is, I think, around 8% of the population in the United States have asthma, which is about 4.6 million kids in the United States.
That's a lot.
It's a lot. And kids are more likely than adults to have asthma attacks. And of that 4.6 million kids that have asthma, over a third of them have had an attack in the past year.
Wow.
And those attacks are common reasons why kids might have to visit the emergency room, be hospitalized, or miss school. So really what all these statistics are pointing to is that a lot of people have asthma. It's a big factor in a lot of people's lives, and it's disruptive to kids going to school, caregivers going to work, and it causes a lot of stress.
Yeah, so we want to make sure we're taking good care of our kids that have asthma so that we can prevent all of those downstream effects.
Exactly.
That makes sense. Well, knowing that it's so common, what are the causes of asthma in our kids?
Yeah, so that seems to be the million-dollar question. There's not one known cause for asthma. It seems to be a combination of both genetic and environmental factors. And we know that genetics seem to play a big role because we see it run in families, and kids that have parents with asthma are at a lot higher likelihood of developing it later on themselves. Having a severe illness or recurrent respiratory illnesses as a younger child also can lead to developing asthma later in life.
Oh.
We also see an association between asthma and certain allergic conditions, other areas of the body that become inflamed. Some examples are eczema, an inflammatory skin condition, or allergies to things in the environment, or even food allergies to things like peanuts or milk or eggs.
So all of those things can be triggers.
All those things could be triggers, yep. There are many environmental factors that play a role, and when you are exposed to certain substances like smoke or air pollution, pet dander, many things, those could be triggers as well. And even more, hot or cold weather, exercising, or becoming sick with a cold or an infection are all things that can cause asthma.
Yeah, I know. I have a little bit of mild asthma myself, and for me, it's always the cold that is my trigger. Not the cold weather, sorry. It's having a cold, like a virus, a viral infection, upper respiratory. But, it's interesting that you point that out because I remember when I was doing more general pediatrics, just how important it was to think about that triad of the symptoms that can be commonplace in kids with asthma. So just like you said, it's eczema, it's allergies, and then there's asthma. And oftentimes those can kind of come to, be coexistent in the same child or in a family. Because of that genetic predisposition as well.
That is a strong association for sure.
What are the symptoms that someone has when they have asthma? Like how would I know as a parent that my child may have asthma?
The hallmark symptom is wheezing, which is a high-pitched whistling sound, and you can't always hear it without a stethoscope. So sometimes you might not know that symptom is happening. Cough is a common asthma symptom. Feeling like you're having difficulty breathing, shortness of breath, or the medical term dyspnea is an asthma symptom, as well as chest tightness. And all of these symptoms result from what we talked about at the beginning, the narrowing of the breathing tubes, the inflammation, which is the underlying swelling, the muscles tightening around the airways, and the mucus that's produced inside of the airways.
Yeah, and if I remember correctly too, like some kids may just have maybe one of those primary symptoms, or they could have a combination when they have asthma. Is that correct?
That's correct. Yes, there's cough variant asthma, where cough is the predominant symptom. There's some kids that have all four, so that is true.
Wow. So knowing that those are the symptoms, what does an actual attack look like?
Yeah. So you may be experiencing those symptoms, wheezing, cough, shortness of breath, chest tightness. Those are asthma symptoms, and you could gain control over those symptoms with a timely dose of your rescue inhaler that you have at home. But when those symptoms become persistent or continue worsening or suddenly become very severe, that is when we would say that you're having an asthma attack. Some other symptoms of a severe attack that we would consider a medical emergency that would require someone to seek emergency care because maybe you need additional medications to stop the attack from happening are that you're breathing harder, louder, and faster than you normally would, that you have trouble talking in full sentences, or some patients even walking. Your child is acting tired or even lethargic. You might have retractions, which are tugging or spaces that you can see between the child's ribs or at the shoulders or at the neck when they're really trying to get air in.
Yeah, so like the skin is sucking in, right? And
Exactly.
You parents, it's something that almost I think most parents don't know until they see it, and they're like, oh, what is that?
Mm-hmm.
Yep.
And that is a severe sign, as well as the nostrils flaring in and out as your child is trying to get that air in.
Well, I think for parents who have children with asthma, it's so important to know what those symptoms are of an attack, because without getting it under control, if you have a treatment plan at home, that could be life-threatening, right? And that's when we see kids in the hospital with asthma.
Absolutely, yes. Those signs that you would want to make sure that you are going to an emergency room or an urgent care right away.
Yeah, we don't want to get there, but if we are, we want to make sure we get help. But knowing that, it's got to be terribly scary for the family. Obviously, not healthy for the child who's having an asthma attack, and then potentially, worst case, life-threatening. What can parents do, or what can we do to help prevent those attacks?
Yeah, so there are things you can do to try to prevent that from happening. The most important, I would say, is if you are prescribed a maintenance inhaler, making sure that you work it into your routine to make sure it's taken every day.
That's hard.
It is
Take
hard.
something every day.
It's hard to remember.
For me to remind my kids, or for me to do it myself sometimes.
Yeah, but that's going to get at that
Yep.
underlying inflammation that we're really trying to treat.
So important.
The other things you can do is living an overall healthy lifestyle. So exercising regularly, eating a balanced diet, keeping a healthy weight, staying up to date on your routine vaccinations, especially with kids with asthma. We recommend the flu vaccine yearly because we know that asthma, when you get sick, can cause it to flare, as well as kids with asthma. We know can have more complications sometimes when they do get these viruses. And the third thing you can do to prevent asthma attacks is trying to minimize the triggers that are in your child's environment if you know that that is a trigger for your child's asthma.
Yeah, so speaking of triggers, as I mentioned, even I'm just sort of throwing in my own personal here experience, but for my son, when we brought him home from China, he had a diagnosis of asthma. And he, the air quality where he was living was not good. And so for him, clearly the air pollution was a trigger because he was having asthma attacks there. He was on a maintenance medicine. And as soon as we brought him home, where the air quality was, I didn't appreciate, but apparently much better, he stopped having any wheezing. And so far, knock on wood, he hasn't had symptoms of asthma and definitely no attacks since we've gotten him out of that environment. So, those triggers, it seems, can be kind of really important for prevention.
Very important. And there are a lot of different triggers, and kids might have completely different triggers than another. I mentioned a lot of them when we talked about things that could cause asthma symptoms, but some examples like air pollution, hot and cold weather, dust, certain harsh chemicals, those smells, or pet dander seem to be triggers. The more common ones that I find in my practice are viral illnesses, infections, exercise, and allergies. What I think is most helpful information for parents is to know what to do to try to minimize these triggers in your environment. So a big one right now, especially with going back to school time, is trying to prevent from getting sick. And things that we can do, it seems simple, but washing your hands, covering your cough, staying home if you're sick, or wearing a mask can be helpful. If cat or dog or pet dander seems to be a trigger, it's best to not have one in your home.
Oh,
it is sad.
That's got to be hard.
It is hard and it is sad, but you'll have that ongoing exposure regardless of kind of how hard you try to minimize that. Reducing smoke exposure is a big one that we really try to urge patients and families that smoke to quit, because again, if that's happening in your home, it's really hard to avoid that.
I know I used to counsel parents that, like, when you smoke in your home, which again, if they quit smoking, that's best for everyone's health. But I used to tell them, like, I had some parents be like, well, we smoke in the back bedroom. I'm like, it's like peeing in the pool. It goes everywhere. I know. Do you like that analogy? Maybe that's bad, but I used to say that all the time. Can't prevent the spread.
It's true. It's very true. So that is something that we work towards, and we have a vaping clinic to try to help kids get there if they're struggling.
That's great.
Some ways that you can prevent dust mites, if that seems to be a trigger, and surprisingly a lot of kids are allergic, would be to use a HEPA filter vacuum frequently, or you could use bedding encasements on your mattress and pillow to prevent the dust mites from settling in the areas where you sleep, or using a damp cloth to remove dust mites rather than a dry cloth or a feather duster that maybe just blows the dust into the air even more, and you're not realizing that you're doing that.
I didn't even know that trick. That's good to know.
Using a damp microfiber cloth seems to be the best.
Okay.
Avoiding strong smelling chemicals, and parents can make their own more natural cleaning solutions that are asthma friendly, using things like vinegar or baking soda.
So what about for those kids that are triggered by cold weather, since we live, particularly those of us that live in the north? I mean, when I was in Florida, no problem, but here it's a little bit of a problem. What do you do there?
Yeah, so for kids that are triggered by cold air, we recommend wearing some sort of scarf or face covering over your nose and mouth when you're about to go outside in the cold air. And hot, humid air can be a trigger too, in which we would recommend trying to be in an air-conditioned environment.
Okay, I learned something. I didn't know hot air could be a trigger too. Wow. So I guess no matter where you live, you could have a trigger
maybe
related to the temperature. Well, what about things that are, outside in our environment that we may not have control over?
Yeah, so especially in the spring and the fall, when there's that time a lot of pollen circulating in the air, we would recommend when you come in from being outside at the end of the day to take a shower and change your clothes to wash that all off.
Okay.
And also when you're sleeping, close the windows because you don't want that pollen coming in.
That makes sense too. Yeah. Just avoid the exposure in the house and then, wash yourself off. It's kind of like what we did during COVID, right? When we were afraid of
Exactly
having the virus on us to come home, take a shower.
Exactly.
Similar.
And then if you're prescribed a daily antihistamine for those that have the seasonal allergies, making sure that you're taking that every day during those periods of time in the spring or in the fall is important too.
That's great. Really helpful. And let's hope that we can keep our environment healthy as possible so that we don't have worse asthma exacerbations for our kids. Yeah. So, Erin, tell me a little bit about how do you actually diagnose asthma, for those parents that are worried about whether or not their child might have it?
There are three main components that we think about when trying to diagnose a patient with asthma. The first is history and exam. So the patient has a history of signs of airflow obstruction, those symptoms that we talked about, the wheezing, cough, shortness of breath, chest tightness. The second is that symptoms are recurrent or episodic, which means that they come and go. There might be a certain situation where you're exposed to a trigger and now you have the asthma symptoms coming.
You see a pattern.
Exactly. And the third is that the symptoms are generally reversible, which means when you're having symptoms and we give you a bronchodilator medicine, we can get those symptoms to go away.
Perfect. So you know that the treatments that we have available are helping, which leads you down that path of diagnosis. Now, I think a lot of parents always want to know if there's like a test for a particular, condition. And, I know that, when I was getting the diagnosis of asthma, we ended up doing pulmonary function tests. But when we brought my son home from China and we were told that he had this diagnosis, we wanted to confirm it here, but unfortunately he was too young to comply because pulmonary function tests or lung tests, they require some participation.
You're right, not all kids can do them. Generally the younger kids are the ones that can't perform them reliably, but for kids that can, we have them do a breathing test, also called lung function test, or you might hear it as spirometry, to help nail down the diagnosis. And what that is we measure the amount of air that your lungs can hold and the speed at which you can blow that air out. So the speed at which you can inhale and exhale. And as you could imagine, in someone with asthma that has those narrowed breathing tubes, they wouldn't be able to blow out as much air as someone with regular sized breathing tubes. So the results of those tests in a person with asthma show evidence that their breathing tubes are narrowed.
I'm going to ask you a little bit more of it's to me, it's a doctor question, but really I think all parents need to know, because we often hear the term reactive airway disease versus asthma. So, it makes sense to me. I remember, when I was in my general pediatrics in the ER and we'd see a toddler come in and have a wheezing episode, an asthma exacerbation or attack, and we were trying to decide whether or not they had the diagnosis of asthma versus reactive airway disease. So I'm curious if you could help all of us understand a little bit of what the difference is between those two terms.
Yeah, that's a really great question. And for young kids, particularly, it's hard to try to nail down that diagnosis of asthma. And that's for multiple reasons. One, we touched upon, because they can't do the breathing tests. Another, because some asthma symptoms are a little bit more subjective. So the feeling of chest tightness or feeling like you are short of breath, and a young kid might not be able to articulate that very well. So maybe we don't know that they're having that symptom when they are. And the third reason is because they're young and there's no prior history of these signs of airflow obstruction, no prior wheezing that we can see as a clear recurrent pattern where we can say, oh, yes, this has happened more than one time, that points us towards asthma.
So I guess we often see kids at a young age having the diagnosis of reactive airway disease, but then they may or may not progress into asthma depending on what you see in terms of pattern and when you can do those, lung tests and things of that nature to be sure.
Right. So reactive airway disease, or RAD as we might call it, is this term that we use. It describes a condition that's similar to asthma because you're having those symptoms, but we're just unsure of the reason behind why you're having those symptoms. Kids in that age range, 0 to 4 especially, more commonly have wheezing with colds normally. And there might be a kid that has one episode of wheezing with a really bad cold, but they don't ever wheeze again and they don't go on to develop asthma, where you might have another kid who has multiple episodes of wheezing with colds that's more consistent with asthma, and we would treat it more that way.
That makes sense. Well, you bring up a good next topic, because I think this is what many people probably want to know about, knowing that asthma is so common, is, what are the treatments available? How do we treat asthma?
Yeah. So I've talked a lot about what happens in the lungs when a person with asthma has symptoms, and that is they become even more inflamed, and we have that muscle tightening around the airways. So the goals of treatment is to improve their breathing, relieve those symptoms, and try to prevent future attacks by treating that underlying inflammation that's happening. Now, there's no cure for asthma, so we're not going to get it to fully go away by giving you any of these medicines, but they help to give you better control and better quality of life over your symptoms. So the treatment is really two-prong approach, with medicines, particularly inhalers, being a big part of asthma management. But the second part is minimizing the triggers in your environment that might be contributing as well.
That makes sense. So there's a combination of prevention and treatment. And then even within the treatment piece, you're saying there's sort of maintenance and then, acute types of treatment.
Exactly.
So can you tell us a little bit about those treatments in terms of like the medications and what the different types are?
Asthma is different in every person, and we know that your symptoms can change over time. So it would be normal for your treatment regimen to be adjusted up or down depending on how you're doing, if your asthma is better or worse. Some kids only have symptoms occasionally and use the medicines for short periods of time, whereas some kids have symptoms that are more persistent and use medicines every day. The inhaled medicines are strongly preferred because the medicine is getting delivered directly to your lungs where you need it most.
Yep,
but some kids with asthma have other medicines for their asthma that are taken by mouth or nebulized or even injected.
My understanding is some of those medicines are even to help prevent the triggers, sort of like, allergies and things of that nature, right? That you try to prevent inflammation due to exposure of allergies, and then that can help decrease the risk of you getting an asthma exacerbation.
So there are oral medications that you can take that help to decrease inflammation and prevent asthma and allergies, which we know are associated.
That's great. Now, thinking about those inhalers, because I think we think of those as being the mainstay of treatment in asthma, can you tell us about the two different types of inhalers that we typically give to kids with asthma?
Yeah, so traditionally there are two main types of inhalers. The first being the controller inhaler, which you might hear your provider call the maintenance inhaler, the prevention inhaler. And these are groups of inhalers called inhaled corticosteroids. And some common ones that we know the names of are fluticasone, or more recently, Asthmanex is becoming more popular. And these are important because they treat the underlying inflammation that is really the problem of what's going on in kids with asthma. There is a difference between corticosteroids and anabolic steroids, or what we might think of bodybuilders or Major League Baseball players using to build muscle. These are different medicines. They work in the body differently, and they are not the same.
Yeah, definitely. We're not talking about bodybuilding here. We're talking about
Nope.
a totally different need and a type of steroid. Great. Thank you for clarifying.
The second type of inhaler is the quick relief, or sometimes it's called the rescue inhaler. And these are a group of inhalers called bronchodilators. And the most common one that we know is albuterol. And these help to relax the muscles that are squeezing around the airways in order to open them up so that you can breathe better.
So I'm curious, how do how do you decide whether to give one or the other or both? And along those lines, I'm hearing about this new smart therapy I want to ask you about.
Yeah, so the severity of your asthma is going to determine what the treatment plan is. There's also, for patients that have trouble with exercise, you could give that albuterol, the rescue medicine, more as a prevention, where you give it before the exercise to relax the airways and prevent them from tightening when you go ahead to do exercise.
That makes sense, because that's the main cause in that situation.
Exactly. And so, yes, smart therapy is a newer type of therapy. It's actually existed in Europe for a decade and been used successfully, but a bit newer in the US. And SMART is an acronym. It stands for single or one, maintenance, and reliever therapy. And what that is the controller inhaler, the medicine that's in the controller inhaler, and the medicine that's in the reliever inhaler are combined into the same inhaler. So there's only one. Certain kids may qualify for this type of therapy. Generally, it's for kids that have more persistent symptoms or moderate asthma. So not all kids are going to qualify for this type of therapy. But if you do, the way that you would use it would be that you take it every day as your maintenance inhaler, but you also take it as needed as your rescue inhaler too. And what's great about that is that you get the benefit of the fast-acting medicine at a time when you need it, but you're also getting dose of the steroid, which is going to help to treat the underlying inflammation or that problem. And it's a good option for therapy because we see that it works well for most patients, and it decreases the confusion between having two different inhalers and trying to remember which one is which.
Well, I imagine for parents, especially with kids, it's much easier to carry around one inhaler and to only have to think about, like you said, the confusion piece, but just from an ease of giving it and bringing it to school and all of that, being able to have, sort of the ability to treat the exacerbation, but also do the prevention in one inhaler makes life so much easier.
Yeah.
And it sounds like it's really effective.
For most kids, I would say it works pretty well.
That's great. That's great. And obviously something to talk about with your care team about, what's the right therapy for you. So we've learned so much about asthma in general. I wanted to, we're here at Boston Children's, learn a little bit from you about, how do we care for kids with asthma here?
Yeah, so we have a group of primary care clinics that can manage patients with asthma, but we also have two specialty departments that see asthma patients, the Division of Allergy and Immunology and the Division of Pulmonary Medicine. And allergy and immunology might see patients with asthma that's associated with allergic conditions, or they have some other inflammatory condition that might require more in-depth allergy testing or more in-depth allergy treatment. Pulmonary might see patients that have more persistent or severe asthma that is difficult to control despite them being on a regimen of recommended therapies already. Pulmonary might also see patients with asthma that also have a comorbid lung condition, something else in addition to their asthma.
That makes them a little bit more complex.
Yes. And of course, we have our emergency department, our inpatient medical floors that treat the kids who are having the acute attacks.
And the hope is to keep kids out of the hospital by getting that really comprehensive care. So thinking about, all of those different specialists that can be, really important in care of kids with asthma, do all kids need to go outside of their pediatrician to specialists, or how would a parent know that, in addition to my pediatrician, I now need to see, a specialist like a pulmonary doctor, a lung doctor, or an allergy doctor?
Yeah, so that would be a conversation with your primary care, which is probably who would be managing your asthma up until that point. And if you're at a certain step of treatment and your asthma is still not well controlled, that would be beyond typically what primary care feels comfortable to manage. And then the decision would be made to make that referral to either pulmonary or allergy, depending on which one is more in line with the type of asthma that your child has.
Great. So kind of comes down to always start with your pediatrician.
Exactly.
They know how to manage asthma pretty darn well, but there are complex kids. And so talk to them about when it's the right time to see other specialists. That's great. So, Erin, at the beginning you mentioned that you're part of the severe asthma program. So I was curious if you could tell us a little bit more about what that program is and how does it fit into the care of kids?
It is a multidisciplinary team of
I love
clinicians that treat severe asthmatics. It's made up of a team of pulmonologists, allergists, asthma nurse specialist, a social worker, psychologist, researchers that all collaborate together to care for the kids with severe asthma. As you could imagine, it's very difficult living with a severe chronic illness and having to remember to take medicines every day, having to come into the hospital all the time to manage your asthma. And our team is really well equipped to attack this problem from all different angles. This program provides extensive evaluations and management program and follows these patients for their long-term care.
I always love when I hear it's sort of like there's a team approach, there's multiple types of specialists involved because, caring for kids with a medical condition is more than just the condition. It's caring for the whole child and the whole family, really, unit. And the fact that we have that program here for those most severe kids is just really great. So. Yeah. That's really exciting. So thinking about exciting things for caring for kids with asthma, what do you see or what do you know of that's going on right now or maybe involved in from a research perspective?
The hottest area in research right now for asthma is looking at how we can try to prevent it from developing altogether. And there are drug trials going on in young kids who are at a high risk of developing asthma based on their family history. And if we can give them a drug that may prevent them from developing it in the future.
That's exciting.
That's
really exciting.
There's always new asthma medicines that we're researching to try to improve outcomes and decrease asthma side effect profiles. And biologics or smart therapy is a good example. And then there are always environmental health studies going on looking at what environmental factors are contributing to patients' asthma and what we can do about them. And most recently, there's been a study looking at gas stoves and how the chemicals that are emitted from that when you're cooking can actually exacerbate people's asthma.
I remember when that study came out, it caused a lot of interest because I don't think that was on the radar of everyone that having a gas stove may increase asthma exacerbations for kids. So,
right.
So as I think, like to your point, as we research and learn more, we're going to learn so much more about how we can prevent this for our kids and then the long-term impact that it has on them. And then ultimately, hopefully save lives so that we have less kids with really serious asthma. That's great. So this is really exciting. As we near the end of our conversation, I've learned so much, and I want to know, is there anything, though, that we haven't talked about that you think our audience would like to know about asthma?
Yeah, so I like to highlight this program because I think it's so wonderful. It's a program that we have here at Children's called CAI, which stands for the Community Asthma Initiative, and it serves kids that are 2 to 18 years old in Boston with poorly controlled asthma. These kids might have recently been seen in our emergency department or been admitted, but Boston Children's providers can also make referrals to the program, as well as providers from community health centers in Boston.
Oh, wow.
And what the program does is a series of in-home visits where they go into the home to do an environmental assessment looking for asthma triggers, but they also can provide you with resources to try to mitigate those triggers in the home.
That's amazing.
It's great. And they do tons of asthma education, but they will review your child's medication regimen with you, as well as help you advocate and guide you to the best way to get help regarding making fixes to your home of the things that they identify. So it's a wonderful program, and the series of visits makes it so they can follow up with you long term and track your progress and how you're doing. And their results are really good. They have an 82% reduction in kids going to the hospital for being hospitalized for asthma.
Which is the number one goal. That's amazing.
Exactly. Yeah. So it's a wonderful that we have this program and that they're able to provide this type of really close follow-up to these patients.
Yeah, and of course, we're very fortunate that we have that here, and it sounds like it's having a big impact, but it's also something that maybe all of our listeners should ask their institutions to see if they have a similar program in their environment, particularly if they have a child with severe asthma. That could be a game changer.
There are more that exist and they're starting to gain some traction. So yeah,
that's exciting.
Asking your provider, they might know.
That's amazing. Wow. Well, this conversation has been so great, and it's also just really, for me, thinking about the fact that, it's been maybe 20 years since I first started taking care of kids with asthma as a general pediatrician, and now I no longer care for kids with asthma since I'm a neonatologist. How much has just evolved, and how much more we know, and how many more therapies, and it sounds like there's even these programs like CAI that can really impact care. So thank you for being with us. I think as we move on to the end here, it's my favorite part of the podcast, where we ask you for your doctor's orders. So I was wondering, Erin, if you wanted to share with us, is there some type of a prescription that you can provide for our parents and family and listeners that can help them raise healthy kids?
Yeah, so I would say if there's a takeaway for families that have a kid with asthma, it would be to know your child's treatment regimen that you've discussed with your doctor. Sometimes we call it an asthma action plan. And what that will do is help you prevent them from having an asthma attack, but it will give you the knowledge to know what to do in the case that they do have an asthma attack. To answer our parents' question from the beginning of the episode, can his kid with an asthma diagnosis play sports? And I would say, yes, your child can do what any other kid can do when their asthma is well controlled. So if they are prescribed that daily preventative inhaler, incorporating that into your routine to make sure that it's taken every day, that way you're optimizing their ability to be able to do the things they want to do, just like any other kid.
That's the goal, to help support our kids to live their best life. I love it. Thank you so much, Erin. It's been so great chatting with you today. Thank you for being here with us and sharing all of this great information for our listeners.
Thanks so much for having me.
Thanks so much for listening to Boston Children's Answers Parentcast. And thank you, as always, to our guest parent, Mike, and our guest expert, Erin Antonellis. As always, please tune in, check us out if you'd like to learn more about important pediatric healthcare topics, helping you raise healthy, happy kids. You can find us anywhere where you listen to your podcasts, and of course, check us out at bostonchildrens.org.